Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello, and welcome. Wow, we have a new intro. Thanks, Vic. That's great. We have a song and everything. Very impressive. Thank you. Well, welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore the real, raw, and relevant aspects of sexual health, relationships, and everything in between. Thank you for joining us today, whether you're live or on the recording, for episode 33, Sexual Health as a Vital Sign, what erectile and sexual dysfunction reveal about overall health. I want to sincerely thank you. You are the reason we are here, and we are so glad that you are here with us. So I want to take a minute just to say thank you for taking time out of your busy life to join us and learn more about this topic. We are on social media. We're out there on Facebook. We're on YouTube. We're on X. We're on LinkedIn. We're on Kick. You name it, we're out there. If you are on X and you have a question, go to YouTube, LinkedIn, Facebook, or StreamYard to allow you to send us those questions. If you are a Facebook follower, follow us. The more people who follow us, the more we can do on Facebook, and we truly appreciate you following us on Facebook. If you go to the website, you can watch previous episodes of Dr. Jeff Talks About Sex and Intimacy. There are 32 of those previous episodes that you can watch. You can pull up the calendar and see all the awesome guests that are coming up in the next weeks, all the way through the end of the year. We have most of the weeks scheduled already, so you'll see all the exciting topics and guests we have coming on. You can listen in your car. We're where you are. So if you have Spotify, whatever your favorite streaming service is, Amazon Music, iHeartRadio, Spotify, whatever that is, you can listen to us while you're in the car, while you're working out. Let us join you in all those places, and thank you for listening. Just want to remind you of a couple things as we go into our episode. First off, that all are welcome. Whatever your sexual orientation, gender identity, or relationship style, you are welcome here. And we are so glad that you have joined us. The goal of the podcast is pretty simple. It is to empower and enlighten you with scientific, evidence-based information to improve your sexual health, to deepen your relationship, helping you live and love more completely and fully. We often think of blood pressure, heart rate, or cholesterol as our body's key health indicators. But what about sexual health? In this episode, we plan to explore why erectile and sexual dysfunction are much more than just bedroom issues. These changes can be early warning signs of cardiovascular disease, hormonal imbalances, diabetes, psychological distress, and other underlying health problems. So by viewing sexual health as a vital sign, we open the door to earlier detection, more holistic care, and better overall outcomes. Tonight, we were going to be joined by Dr. Mohit Khera, but he was not on the podcast yet when we started. So we are going to do the podcast anyway.
Hey, Jeff, I got good news for you. Dr. Mohit has joined us.
Yay! So this is with a live broadcast. This is exactly how we have it here. So I will continue to tell you about our excellent podcast this evening. Welcome, Dr. Khera. I will finish my intro, but I'm so glad you're here.
Thanks, Jeff. I was coming as fast as I could. Thank you.
Dr. Khera is busy in his clinic, so I'm sure he was busy doing all kinds of things. I will finish my intro for you, and we will be right over to you again. Okay, awesome. I'm so excited because this is going to be such a great episode. We're joined by Dr. Mohit Khera, one of the nation's leading experts in sexual medicine, to discuss how these signals show up and what they mean, how clinicians and patients alike can use them to protect long-term health. We're going to explore erectile and sexual dysfunction and how they often act as an early indicator of broader health signals. So hopefully getting you to find out about some overall health things early on so you can intervene and live a whole healthy life. So our guest tonight, Dr. Mohit Khera, he holds the F. Brantley Scott Chair in Urology and serves as professor of urology at Baylor College of Medicine in Houston. And that's where he is very busy in his clinic. You'll hear more of why he's busy. And we're so glad that he was able to take time out and join us. He's a board certified urologist. He specializes in male and female sexual dysfunction, men's health, male infertility, and the management of declining testosterone levels in aging men. He also wears several leadership hats. He's the director of the Laboratory for Andrology Research, medical director of Baylor's Executive Health Program, and president of the Sexual Medicine Society of North America. So he has been very involved in that organization, and that's where I know him from. He is a prolific researcher and clinician. He has launched numerous FDA-approved clinical trials, published over 160 peer-reviewed articles, delivered 400-plus scientific lectures worldwide, authored and edited 2 books and numerous book chapters. I'm sure by the time I say this, he's probably done even more than that in sexual medicine and men's health. Dr. Khera's contributions extend beyond academia. He's repeatedly been recognized as one of Houston's best doctors, and he provides amazing, comprehensive, individualized care to his patients. And it has been such a pleasure knowing him and calling him my colleague at Sexual Medicine Society. I am so happy to greet and introduce you to my friend and colleague, Dr. Mohit Khera.
Jeff, first of all, thank you so much for that introduction. You and I have known each other for 20 years. You and I started together at the SMSNA. It's been amazing to see you grow, flourish, and do so well. And I really, really applaud you for this podcast and the information you're getting out to people. It's really important, and it's not something that people talk about very often. So really, thank you for all the work that you're doing.
Oh, thank you. This is what I'm all about, educating and advocating for patients, and you too. So we share that passion. So without further ado, I am so excited about your presentation. It's all yours.
Thank you. Do you want me to do presentation mode? Is that right?
Yes, it did.
Let me just do one thing here.
Yep. So hit present.
Yep. And let me just do slides and PDF.
Yep. And you go to my computer.
Got it. Give me 1 second. And give me 1 second here. It will just take me a second. I apologize for the delay. So just bear with me.
No worries. This is the fun of live podcasts. We've got people's children come into our podcast. We've got all kinds of things happen. So we don't worry about it. It's all good.
I appreciate that. And you've been doing this podcast for how long now, Jeff?
We started at the beginning of the year. And so this is our 33rd podcast. We do it every week on Tuesdays at 7:00. And we have awesome guests on. We've had some sex therapists, we have urologists, gynecologists, all kinds of great people come on. So
that's amazing. So bear with me. What I'm going to talk about today is something that I'm passionate about, and it's a concept called sex span. And you may have heard of the word of lifespan, and you've heard of the concept of health span. And I think that most of us want our health span to last as long as our lifespan. But truly, most of us don't think about our sex span. And that's how long we're going to be able to have sex. And I think most people would like their sex span to last as long as their lifespan, right? Mm-hmm. For me, I don't want to live till I'm 90, but only be able to have sex till I'm 50, right? And there are things that you can do today to prolong your sex span. And I think that's very important because, people come to me and they have ED, or they come to me, let's take it back. You come to me and you have diabetes and cardiovascular disease. That's a little too late. You should have come to me before you developed the diabetes or the cardiovascular disease. And the same concept goes for ED. When you come to me and you have full-blown ED, there are many things that I could have done earlier to prevent the ED from happening in the first place. And so I think it's very important that everyone realizes that there are things that you can do today to preserve your sex span. And so that's really what we're going to talk about today. As it's uploading, I do want to make a couple other comments because the title is, What Do We Know About Erectile Dysfunction? ED is the first marker of other underlying conditions. And I think of ED as a symptom. It's not a disease. It's a symptom of other major problems. And so when a man has ED, maybe it's a symptom of his diabetes. Maybe it's a symptom of his depression. Maybe it's a symptom of anxiety. Maybe it's a symptom of cardiovascular. That we realize that these are all just symptoms. So again, my slide deck is up. I see it's there. And how do I then get it? Do I just put it into the area here?
Vic is putting it in.
We're going to get your slides added to the stage.
Fantastic. Yep. Thank you so much.
Yeah, it'll be in there in just a minute, and then we'll drop off and let you be on here with your slides in just a sec. And then
how long do I have for the
So typically the presentation itself is about 15 to 25 minutes. If that sounds good. And but we're going to go with what you go with, because we're so excited about you presenting. And so I'm going to disappear and it's all you.
Love it. Thank you so much. And again, thank you so much for this opportunity. And I'd like to just kind of give you some highlights of my talk. These are my disclosures. And really, I think about erectile dysfunction as something that we've been looking for a quest to cure this for centuries. You know, if you look at the ancient Egyptians, they talked about using crocodile oil mixed in wood hearts and rubbing it on the penis. They talked about ingestion of testicular tissue in the past. Everyone has been looking for trying to find a cure for ED. But I talked about this earlier, the concept of lifespan and health span. These are in the media all the time. And we all want to have a very long life, but we want to be healthy during that entire time. But we also want to be able to preserve our sex span. So I want to show you some statistics. This is what we do not want. I don't want to live till 81, but be able to be healthy only till 50 and have a sexual life until 70. That is not what I desire. I personally desire that my health span and my sex span last as long as my lifespan. I think that's really, really important. And so look at the reality. So in the United States, on average, our lifespan is roughly 77 years old. It's 75 years old for men, 79 years old for women. But our health span is about 67 years old. And the CDC would say it's only 63 years old. So here's the problem. You live till 77, but you're really healthy till 67, and that's got to change. And if we look at the reality of sexual function, we know that roughly 45% of men and roughly 17% of women are still having sex over the age of 70. And the reality is that there could be many reasons why they're not having sex, but most of them are either not interested in having sex, which means low desire, or they're not able to have sex, meaning ED, dyspareunia. There are many, many causes. So every country is bragging about increasing their lifespan. Don't brag about increasing your lifespan if you're not going to also increase your health span. Now, if you look at the media, everyone is talking about this bi-directional relationship between mental health and physical health. But they're missing one important component, and that is sexual health. Sexual health is the best barometer of a man's physical health and mental health. Because if a man is in great shape, but suffers from depression and anxiety, it will take a hit on his sexual health. If a man has great mental health, but very poor physical health, that will take a hit on his sexual health. So to me, a man's sexual health and a woman's sexual health is the best barometer of their overall health. Now, this is what I was talking about earlier. Ian Thompson had a phenomenal study that showed that this is looking at 4,247 men. He followed them prospectively, and what he showed was the following. If a man gets erectile dysfunction today, 15% of them will have a heart attack or stroke within 7 years. 15%, it's a lot. And there's a theory behind this, and it's called the arterial diameter theory. And it goes like this. We know the penile arteries are the smallest, 1 to 2 millimeters. We know the coronaries are 3 to 4 millimeters. We know the carotid are 5 to 6 millimeters. And it's true. You're more likely to get ED before you get a heart attack. You're more likely to get a heart attack before you get a stroke. You're more likely to get a stroke before you get peripheral artery disease. We occlude the smallest arteries first. So you may have heard of this, the canary in the coal mine. It's essentially telling you when a man gets ED, screen him for cardiovascular risk, because there's a chance that he could have cardiovascular disease, and it's occult. I love this study. This is a really nice meta-analysis showing that if a man gets ED today, He's a significant increased risk of having a heart attack. He is a significant 39% more increased risk of having a stroke and a 25% increase in having all-cause mortality. So again, take a man's ED seriously. It's not just about his erections. It's the best barometer of his overall health. This study made a big impact on me. It came out of Greece, and I think about this every time a patient comes in with ED. And basically, they had these 50 men that came in with ED, and they decided to have them undergo a stress test or an echocardiograph. If they were positive, they had an angiography. And the take-home message is that 20% of patients who walk in that door have either 1 vessel, 2 vessel, or 3 vessel disease. They have blockage. So I think it's a huge disservice to hand a man Viagra and let him go on his way when you're not screening him for other potential causes, diseases. And 1 out of 5 men are going to actually have cardiovascular disease, blockage in the heart. And it's a shame, because if you could do something today, as opposed to 10 years from now when he has his first heart attack, you can make a big difference in his overall lifespan, health span, and sex span. So in terms of the this study, this is looking at occult diabetes. And these are patients that came in. This is coming in from 2001, 2004. And what they found is if a man has ED, he's 2 times more likely to have diabetes. If he's between the ages of 40 and 59, it increases his likelihood by 5x of having diabetes. But this study made the greatest impact on me on diabetes. This is young men. Now, I want you to think about this. They're between the ages of 18 and 40 years old, so they're young. And they came in for erectile dysfunction in a clinic. And what they found was if a man comes in for ED, 30% of them had occult prediabetes or diabetes, 30%. Now, I think about this when I was between the 30 years old. There's no way when I was 30 was I going to go into a doctor's office to get my annual screen. I wasn't going to go get my blood pressure checked or my hemoglobin A1C checked. But I would, if a man had ED, you better believe he's going to come in first thing tomorrow morning, because he takes that very seriously at that age. And so what I'm trying to tell you is this is a golden opportunity to screen those young men for other conditions that they would have not come in for otherwise, to get screened. We know that young men, roughly 45% of men between the ages of 18 and 39, they don't go in for annual screening. 33% of these men had just 33% of these men had got recommendations for cancer screening. They do not get screened. So sexual health is the gateway to screening and improving a man's health. Take it seriously when that man comes in, because there's several underlying conditions: cardiovascular disease, diabetes, and mental health. Let me show you some examples. One thing that I do want to mention is that we know that many men are now getting their sexual medicine drugs online, and the online forums and companies are doing this asynchronously, meaning you never meet the doctor. You just enter your data, they look at it later, and they ship you the drug. But the problem is that's missing a big opportunity to screen for other comorbid conditions. And I think we really need to take a look at how this is being, these medications are being delivered. I talked about depression and anxiety. I will just tell you that men with ED are 2.5 times more likely to have anxiety, 3.5 times more likely to have depression, and it's bi-directional, which means if I improve a man's ED, I improve his depression. If I improve a man's depression, I improve that man's ED. So again, most of these conditions are bi-directional. Now, whenever I give a lecture to the residents, I talk about the statistics. And did you know that 40% of men at 40 have erectile dysfunction, roughly 50% at 50 have erectile dysfunction, 60% at 60, and 70 at 70. That is an alarming number. And many patients say, I can't believe this is happening to me. And I say, Mr. Smith, this is a natural part of aging as you get older. Now, I will tell you that healthy men do not really develop erectile dysfunction. It is the acquisition of comorbid conditions as we age that you will develop ED. So as you become more sick, as you become older, you will develop ED. A healthy 80-year-old man typically should not have erectile dysfunction. And that goes back to my point that ED is a symptom of other conditions. It is not a disease on its own. So this is a survey looking at 1,500 men in the US, 18 to 80 years old, and they sent it out. 40% of these men said they had some sexual health issues. 53% said they don't know they don't know how to improve their health. They have no idea how to get treatment for their sexual health. But 69% of those men said, but if you tell me where to go, I'll seek therapy. Now, what's shocking is that only 51% of them discussed this with a medical professional, and only 44% discussed it with their partner or spouse. Now, you can say to me, well, how did they not discuss it with their partner or spouse? And the reason is that men, what they do is they avoid sex, right? So as a man gets ED, instead of confronting the issue, they just start avoiding sex. The problem is that the partner feels like it's rejection and it can lead into other issues. But again, I call this suffering in silence. I don't know another condition that men and women suffer from that's so prevalent that they're too embarrassed to talk about it. And this is a huge segment of the population that just simply suffer in silence. Now, I'm a big proponent on sexual dysfunction as a couple's disease. It is not about a man. It's not about a woman. It's about the couple. And I will give you a story, an example. When I finished my residency in 2006, I did my fellowship in 2007, and I was really good at getting men great erections and great libido. And one day a woman called me and she was extremely upset. And she said, I just want you to know that my husband and I had the best relationship until he met you. And now every day he wants to have sex and I don't want to have sex with him. And you've ruined our relationship. And at first it didn't make sense to me, but after a while I realized she was right? There is no point in raising one libido and leaving the other libido low. In fact, it's perfectly fine to leave both libidos low, but you never raise one libido without raising the other. And so that year I flew out to spend some time with Dr. Goldstein, who's the godfather of female sexual dysfunction. I went to a lot of the Ishwish courses. And now for this past 17 years, I've been treating women for female sexual dysfunction. And I think it's really important because it's not just about the person you're treating across from you in the exam room. It's also that person at home who's also suffering from this patient's sexual dysfunction. And we have to remember that. So many people don't know what female sexual dysfunction is. And female sexual dysfunction is comprised of 4 disorders: low desire, arousal disorder, orgasmic dysfunction, and pain. If she has any one of these and she's bothered by it, she suffers from female sexual dysfunction. Now, you have to realize that roughly 43 to 48% of women in the United States suffer from female sexual dysfunction. Only 19% of these women ever seek therapy. Talk about a large unmet need. Talk about a huge population of people who are suffering in silence. So this is the study that made a big impact on me. This is the Goldstein study. And very simply, he gave 229 men with ED. He gave them either Levitra, which is used to treat erectile dysfunction, or placebo. But he did something very clever. He gave all the women at home, the partners, the female sexual function index questionnaire, assessing their sexual function. And what he found is in those men who gave Levitra to help with erections, the women's sexual function significantly improved. In those men who got placebo, the women's sexual function did not improve at all. And the greater the improvement in erectile function correlated with the greater the improvement in female sexual function. So again, suggesting that by treating one partner, you're actually treating the other, right? And we've shown that both ways. So you can indirectly treat the other partner by just treating the partner in front of you. This was another study by Goldstein also looking at men with Peyronie's disease. Peyronie's disease is an abnormal curvature of the penis when it's erect. These men were treated with a medication called collagenase to improve the curvature. What did they find? Those men who had the medication actually had improvements in curvature and less bother. But if you look at the right-hand side, if you look at the female sexual function index questionnaire in all the women, significantly improved the female sexual function in the female partners without ever meeting them. All they did was treat the male partner. So, and we actually showed this as well in men after radical prostatectomy. If you do surgery, those men who are widowed and have no partner to have sex with, they do not recover very well. men who have women who are very engaged in sexual activity, they tend to recover their sexual function very quickly. That makes sense. How do we treat women? There's a lot of options, but it's, there's vaginal lubrication, there's sex therapy. It's multifactorial. You can also treat the male ED to treat the female sexual dysfunction. I typically tell everyone there's a triangle. It's called estrogen, progesterone, and testosterone in women. It's very important to give her a triangle, but there are also many non-hormonal ways to treat them as well. Vyleesi is now FDA approved. It's an injection she takes 45 minutes before sex and increases her desire for intercourse. And then the first drug ever came out for female sexual dysfunction was called ADI. And ADI came out in 2015. It's a pill that she takes every day, and it's FDA approved strictly to make her want to have sex. That's it. And it works quite well. And we use this medication quite a bit in women to help with libido. Now, testosterone is very important in women for many reasons, but we still do not have an FDA-approved testosterone product in the United States for women. So we typically use 1/10 the dose we use for a man. We use 1/10 for a woman. The reason I bring up female sexual dysfunction also is that many of the drugs that we use for women, we also use for men, and vice versa. You can use them off-label in either gender. We now have started the first clinical trial in the United States using ADI in men. We found that it does help with libido, but it also helps significantly with orgasmic function. This is a really cool study that I published. It was a case report. I had a 28-year-old man who had never had an orgasm in his life. We call this lifelong orgasmia. And we tried everything. We tried sex therapy. We tried Wellbutrin, dopamine agonists. And finally, we tried ADI, and it was off-label, and he had his first orgasm. And this gentleman can now orgasm about 40% of the time with the medication. So again, there are medications that we can use in men that we also have historically used in women. I will say that women are not that much different from men. So women, if she suffers from poor arousal, which is poor blood flow to the genitalia, it's a strong indicator that she may also have diabetes, hypertension, dyslipidemia. It's also a marker of underlying health conditions as well. And we know that if you take women who have coronary artery disease and you put them on a cardiac rehabilitation program, you can significantly improve their sexual function as their cardiac function improves. So it's bidirectional. Now, here's the most exciting part of my talk. I really believe at this point that we should focus on lifestyle modification. Historically, we've focused on giving patients a pill and we say, see you later. And to me, the best thing that you can do for somebody is to modify lifestyle. So diet, exercise, sleep, and stress reduction. Each one independently has been shown to significantly improve our sexual function. And I want to just be very clear. I don't have a pill on the planet stronger than diet, exercise, sleep, and stress reduction. And when we talk about diet, we talk about things like the Mediterranean diet, which can actually improve sexual function. I did a large study showing that exercise, at least 160 minutes a week, can actually improve sexual function and reverse ED. So exercise alone. We know that sleep is very important. If you sleep less than 6 hours a night, 6 hours or less, it can significantly increase erectile dysfunction. 7 hours or greater actually it helped improve erectile function, but sleeping greater than 9 hours did not offer any further benefit. And the number one sleep condition that's associated with erectile dysfunction is sleep apnea. So we always like to screen for sleep apnea in the patients who have ED. And then finally, stress is important as well. Remember that stress can decrease a man or a woman's desire for sex, and it can also increase erectile dysfunction as well. So, Jeff, I don't want to go over my time. I know that you asked me to stay within the limits, but I thought maybe I could open it up to any questions, comments, or thoughts.
All right. So we have a small problem. Jeff's computer crashed.
Oh, no.
He's not available.
No problem.
But we haven't met before. My name is Vic Sinise. I'm the producer of his show, and I have podcast of my own, UroNurse, the one that you can see on my shirt, is a
Okay.
program for urology healthcare. Hopefully Jeff will get his problem fixed. I'll bring him in if I see him popping on the screen, but
No
otherwise you and I could hang out.
Yeah,
It's
no
interesting.
problem at
I
all.
had a physician on Saturday by the name of Wayne Kwong, and he had mentioned that he was talking about bladder span, and you just
Yeah, I
talked
know
about
Wayne
sex
very well.
span.
Wayne's been in Albuquerque, and he's a good friend of mine.
Yeah.
And a wonderful guy.
So it seems like this is getting the new trademark. Everything's a span.
It's a
Your
span.
lifespan, your sex span, your bladder span.
Yeah, I think
everything
bladder
will
span
improve.
makes sense. I mean, bladder, we have a finite amount of bladder capacity, and you want to
Yeah.
make sure that your bladder, I think it's very, very clever. You want to make sure your bladder lasts as long as your life. And if it doesn't, it's called a neurogenic bladder. And in those cases, we'd have to put in a catheter or a suprapubic tube because your bladder doesn't function. I don't have the technology to bring your bladder function back. But Vic, I wanted to bring up one thing since we have a little more time that's really important to me. And I didn't get to talk about this, but I wanted to talk about something called daily Cialis and why it's so important to me. So Cialis, as you know, is a medication that's used for erectile dysfunction, and it's used on a daily basis, or you can take it on demand. But it's the only drug out of the class, like Viagra, Levitra, Cialis, that can be taken daily. And that daily dose is 5 milligrams. And I find that medication to be extremely important for several reasons. The first is that it helps preserve erectile function. So if you look at the muscles in the penis, it can actually cause hypertrophy of the muscle over time. There have been numerous studies looking at biopsying the penis before, biopsying it 3 months later, and showing that you can preserve the muscle. The second thing that's really nice about that medication is it's FDA approved to help men urinate better. It's FDA approved for BPH, so that's actually great. And then the third indication is it's actually FDA approved for something called pulmonary hypertension. And it protects the lining of the blood vessels called the endothelium. And there was a wonderful study by Dr. Kloner, I believe 2 years ago, that showed that those men who were taking daily Cialis had a 13% reduction in cardiovascular disease and a 25% reduction in mortality. And so if you think about it, it's a single medication that can help the heart, can help the prostate, and help the penile tissue. So for men, I like that medication a lot. And so I really do promote taking that medication.
Yeah, I've seen that same study that you're talking about. And I think that's it's amazing. If you're going to pick one of them, you may as well pick the one that you can be at it every day and not only help your heart, but help your erections. And you had mentioned, because that sometimes the precursor to heart disease, the very first warning sign can be ED. And as you were mentioning, the size of the vessels makes a huge difference.
Yeah.
The penile vessels are very small compared to the coronary ones.
That's exactly right. It's a canary in the coal mine. So, when a man comes in, it's so easy just to hand him the Viagra and tell him to go away, because he's going to take, but the Viagra, I use the analogy, if you broke your leg today, I have two choices. I can either fix your leg or I can give you Vicodin. Because if I give you Vicodin, you can probably still walk, until the Vicodin no longer works or the leg gets so bad that you can't walk at all. So to me, Viagra is Vicodin. That's all it is. It's not a cure. It's just covering your problem that night. Hey, Jeff, how you doing? I think we got Jeff back. Yeah.
Having a little
No problem. I was talking about Viagra and how I think it's deceptive, because people take Viagra. It's not a cure for ED. It's just covering your problem. And I think that lifestyle modification is a cure. Diet, exercise, sleep, stress. I also think that taking daily Cialis can help cure. But Viagra is not a cure for ED. And many times it's so easy as a clinician to hand someone Viagra and say goodbye, because they'll be happy, but you're not curing them per se. You're just putting a Band-Aid on the problem till the Band-Aid stops working, which is, I think, a mistake.
Definitely a mistake. And I agree with you. When people are always looking for the underlying, what can I do to make things better, that kind of thing. And I think you're absolutely right. The diet, that triad of diet, exercise, weight control, the Princeton 4 report clearly told us after previous reports the same message that diet, exercise, weight control are powerful mediators of overall heart health and overall sexual health.
I agree 100%. And so, I really push the diet, exercise, sleep, and stress. I take care of a lot of people, and they are very good at diet and exercise many times. They're type A, they take care of their diet, they go to the gym, but they're lousy at sleep and stress. Lousy. And that's 50% of the story. So you need to make sure that you're really focusing on all three. I got to tell you something very important. I came up with this concept a while ago that most people get. It's called offense and defense. Okay. And offense and defense is very simple. It's 4 and 4. There's 4 on offense. There's 4 on defense. On offense, it's diet, exercise, sleep, and stress reduction. Those 4 things will move your health forward, which is really important. On defense, there are only 4 ways where we can die. Unless we get in a car accident or a plane crash or something catastrophic, there's only 4 ways we can die. It's either we're going to get cancer, we're going to get a heart attack, we're going to get what we call metabolic disease, diabetes, obesity conditions, and we die from neurodegenerative diseases like Alzheimer's or Parkinson's. And so if you know that, Jeff, if you knew that those are the 4 ways that you could die, you should do everything in your power to keep those things away. It's really important. Keep up with your screening. Screen your heart. Screen cancer screening. Make sure you screen for metabolic. I use a CGM many times, a glucose monitor, just to make sure that the patients are not getting too high of a sugar. These are all very important things to do, is to, obviously offense and defense in men's health, or even in women's health, is very important.
Yes, definitely very important. Yeah, hopefully it's better. I don't know what exactly is going on with the computer, but lots of things. So hopefully it's coming through fairly clear now. I agree. I think you had talked earlier about how, maybe people are not interested. Maybe there are different reasons why people aren't having sex as their marriage or their relationships move along or later in life. And I think for women, there's things that come up like vaginal dryness, atrophy, different things. And for men, other issues like the erectile dysfunction. But I do think that I really like the point you make about throughout our life, how can we live the best quality of
Vic, I think I lost him, but I understand. Yeah. I understand the question, and the question really is the best quality of life. And I will tell you that if you look at couples who are engaging in sexual activity, they tend to be happier. They have greater fulfillment in life. They tend to have better qualities in their relationship with their partner. And so it is something that I think significantly enhances someone's quality of life. Quality of life can significantly improve if you're engaging in sexual activity. Now, I'm not saying that you have to be sexually active to have a great life. I'm not saying that at all. But I can say that it does enhance your quality of life. And so many people, and sexual activity can be anything what you define. It doesn't have to be penetrative sex, right? It's just whatever works best for the couple, give them intimacy. And so we find that those couples that engage in some type of sexual activity tend to be happier. They tend to be happier individually and happier as a couple. And so it's very, very important, I think. And I think that, many times we get older and couples stop having sex and they say, oh, it's just a natural part of aging. And then when they realize that, no, that's not, you can actually continue to engage in sexual activity. If they haven't had sex in many years, it actually can really be life-changing, where they can start living their lives together once again. So I feel like it's important. Now, look, it's not important to everybody. Some women, some men say, I don't want to have sex. I'm perfectly fine without having sex. And that's perfectly fine. My job is that if you do want to engage in sexual activity, that I give you the ability to do so. That's what I'm in the business in. I guess I tell my colleagues, we're in the business of prolonging sex spans,
Yeah, exactly.
Mm-hmm. Excellent.
Jeff, I did see some
Yeah,
questions.
I think
come through.
those are
Maybe I can
really,
grab
really
those
good
while
points. Vic, did you?
Since we're having some trouble getting you in, I'm going to bring up the questions for you.
Yeah.
Yes.
So first
go
question
ahead
I
and
saw
go ahead and bring up the questions. That'd be great.
is, I feel embarrassed bringing up sexual problems with my doctors. How can I start that conversation? Do you have any good hints for how we can?
Yeah, I find out that the direct method is the best method. You just say it, right? Because at this day and age, there's nothing to hold back. You could say, I tell patients, just say, a lot of them come see me because they have erectile dysfunction. They'll say it. But the reality is say, Dr. Smith, I'm suffering from erectile dysfunction. Are there any treatment options for me? Very direct, very to the point. There's no embarrassment here. I mean, it's a natural part. Most men suffer from this condition, right? And so I find that the direct method is the best method. Here's the problem, though. The problem is that many clinicians are uncomfortable dealing with it. So let's flip it. That's where it gets a little tricky. So if you look, I'll give you a story. My wife is a family practitioner, and she says, look, I have about 15 minutes per patient. I have to deal with hypertension, diabetes, obesity, metabolic syndrome. I don't have time for ED, right? And I say, okay, I get it, but it's extremely important. And in fact, that may be the most important thing on that person's mind when they come in. And addressing that, I think, is extremely important. Even if it's a questionnaire before they come in, give them a questionnaire. So it gives you the opportunity that you see if the score is bad or not. And right off the bat, you can address it. But you have to have some gateway to come in. But for patients, I think it's extremely important to be very direct and explain that I'm suffering from a condition. I have ED, I have premature ejaculation, I have Peyronie's disease, whatever it may be. What treatment options are available, period. And if they don't have treatment options, send me to a urologist, send me someone who knows what they're doing. But there's no reason to suffer in silence at this day and age when we have such amazing treatment options. There is no reason to suffer in silence. And look, if you're really embarrassed, use an online platform. I'm not the biggest fan, but you can use an online platform because you can get the treatment and what you need in the convenience of your own house without talking to anybody, and even just on your app. And that will be able to address the situation as well. So I think that, this day and age, there's no reason why you should be suffering in silence.
Yeah, I think shows like this can kind of help people feel more comfortable asking the question because, for us, a lot of times I notice in our office, it's like as you're walking out the door, it's, oh, by the way, I have erectile dysfunction. What can I take?
Yeah, and then
that's conversation.
Yeah, that's exactly right. And so clearly have a direct method in speaking with your clinician. Another important stat: only 50% of medical schools teach sexual dysfunction. 50%. Of those 50%, 50% of those students said that their training was lousy. So it's really a quarter of the country is getting some kind of education by the time they start residency. And if you're starting residency in a discipline like dermatology or GI, you're not going to get sexual dysfunction training in those specific ones, right? So all you get is what you really get in medical school in those disciplines, and it's only 25% of the population. So it's not a lot. It's not a lot.
Yeah. All right, another question here. For men like myself experiencing sexual changes, what kind of test or evaluation should I ask my healthcare provider about to make sure my overall health is being addressed?
Yep.
So what test would you order?
Love this question. So there's 3 tests you're supposed to get in men with sexual dysfunction. It's a hemoglobin A1C to look for the blood sugar. It's a lipid panel, and it's a testosterone level. We didn't talk a lot about testosterone, but I am passionate about this topic. Testosterone is the best barometer of a man's overall health. There is not another blood test on the planet that's a better indicator of his current health and his future health. And I'll give you an example. When we think about low testosterone, it's associated with erectile dysfunction, low libido, muscle mass, fat deposition, poor sleep, depression. Those are all what we call quality of life. So we know that a man who has low T is more likely to have poor quality of life. But what you don't know, most people don't know, is that low T is an indicator of other coming poor conditions. For example, a man with low testosterone is much more likely to have a heart attack, non-negotiable. Fact. A man with low testosterone levels is much more likely to break a bone, osteopenia, osteoporosis. Fact. A man with low testosterone level is much more likely to get diabetes, obesity, metabolic syndrome. A man with low testosterone is much more likely to get depression, was one of my studies. So I'm not talking about sex anymore. I'm talking about your health. So, and if your T is low, not only would you suffer from today, it's a predictor of those who are going to get cardiovascular disease in the future. So you show me another blood test that has a better indicator of a man's overall health. It's not your thyroid. It's not your hemoglobin A1C. It's not your lipid panel. It's your testosterone level, the single most best predictor of your current and future health. Remember that testosterone levels, it's a myth that they go down as we age. They don't go down as we age. A healthy 80-year-old man will still have relatively normal testosterone. The T levels go down when you get illnesses like obesity, diabetes, metabolic syndrome, sleep apnea. All of those shut down your T levels. So sick patients, low T levels. So it always bothers me whenever I go into my primary care doctor's office and I go in for an annual screen. He checks my thyroid. He said TSH. I said, why are you checking my thyroid? He said, that's an annual screen. We check a TSH. I said, what about my testosterone? He said, yeah, there's no need. I said, what is the yield of a thyroid compared to a testosterone in terms of my overall health, right? It's a waste of time. Every man over the age of 40, every single man should have an annual testosterone level checked, and they should insist on their primary care physician to check their testosterone level. The cost, even the cash price of a testosterone is $39 to check it. It's very cheap. Check it and monitor it and follow it once a year. It's extremely important.
Yeah. And then it's kind of scary because we're finding out that the next generation is having lower testosterone levels.
Decade by decade, we're having lower testosterone levels for many reasons. If you superimpose a graph on obesity, diabetes, metabolic syndrome, decade by decade, that's getting worse also. You superimpose some of the foods that we're eating, some of the phytoestrogens that we're taking in, some of the environmental factors. If you factor in stress, because stress plummets T levels, then you will see that that's why our T levels are falling. I do some work with the military, and I had the privilege of presenting at special operations in Tampa and on the base. And this is special SOCOM. So these are special operation forces, and they are interested in learning more about testosterone. And did you know that if someone goes through military training and they go through Hell Week, they will see a precipitous drop in their testosterone levels. And even when Hell Week is over, weeks after that stress is done, the levels of T will stay suppressed, which is an issue. And so stress in itself, whether it be physical stress, mental stress, any type of stress will shut down testosterone levels. And what I never understood was the following. You know, the military is very strict on not supplementing men with testosterone if their levels are above 300. And remember, that number 300 was arbitrarily made up, right? So we know that men at 320, a lot of them have symptoms, but they can't get the treatment in the military. They 350, they can't get the treatment. But some of the countries give their soldiers high levels of testosterone. In fact, in World War II, the Germans used to give the infantry high levels of testosterone injections because it gave them more energy. They were more aggressive. They could fight better theoretically. And I always thought it was unfair. If you have a soldier that has a testosterone level of 900 and you have a U.S. soldier that has a testosterone of 320 and they're not allowed to supplement, the U.S. soldier is at a disadvantage. I personally think they're a disadvantage. So we need to rethink the level that we think is appropriate for people who are in our military services. I think that 300 is too stringent of a cutoff.
Yeah. I don't know if we got Jeff working or not. Are you able to get through to us, Jeff? Or I think you're struggling still.
Yeah, I'm not sure if you hear me now. I'm going to try.
Yeah, it's coming through, but it breaks up on us.
I'm going to try thing. Hold on. Let me try this way.
All right. All right.
Whoops.
Can you hear me and see me
Yeah.
now? Yes.
Much better.
Okay. We're going to go this route. You always have to have a backup plan. So this is our backup plan. And anyway, Wow, Dr. Khera, just awesome, great information, just as I expected it would be. And I'm so happy with everything you presented and all the information and great answers to questions, everything. So much good information to help people live better, healthier sexual lives. And I love I love all of the different things that you look at. I think sex is an inherent, really important part of our lives. And continuing to have sexual health is essential to the human journey. So just excellent stuff. We end with a closing centering exercise. We'll find out what's coming up next week, and then we'll come on you and I in just a second to say goodbye, and we'll close out the podcast. So I'm going to go to my closing centering exercise. You know how we do this every time, so I really, it's been a little bit of a challenge with our electronics today, but we're still here. Now I'm on my phone, but let's do a centering exercise. We need a centering exercise. There's been a lot of technical things, at least for me tonight. So let's take a moment to connect the dots between the conversation we've had and your own well-being. Wherever you are, find a comfortable position. If it feels right, close your eyes, begin a slow breathing pattern in through your nose and out through your mouth. Gently place one hand over your heart and the other hand over your lower abdomen. Continue that breathing pattern about 4 counts in and 4 counts out. Feel your breath moving under your hands, steady, natural, life-giving. As you breathe in, silently say to yourself, I listen to my body. As you exhale, say, I care for my whole self. I care for my whole self. With each breath, imagine your body as a network of signals. Your heart, your mind, your sexual health, each offering valuable information. Notice that none of these signals are separate from the others. They are all part of your one whole, miraculous, vibrant self. Take one more deep, nourishing breath in. Let it out slowly. When you're ready, open your eyes and carry forward the awareness that paying attention to sexual health is paying attention to your overall health. Well, it's been a great episode. Can you show us what's coming up next week?
Can acupuncture really improve sexual health and intimacy? In this episode of The Healing Path, Dr. Susan Kellogg-Spatt, a leading expert in women's sexual health, is joined by licensed acupuncturist Dori Ellen Fish to explore the fascinating connection between acupuncture and sexual wellness. Together, they discuss how acupuncture may help with circulation, hormonal balance, pelvic pain, stress, and overall sexual vitality. Join us on August 26th at 7 p.m. Central Time to learn more.
Wow, Dr. Khera, thank you so much for an awesome episode. I'm so sorry I had some technical difficulties.
Okay, Jeff, we did a great job. We got through it.
We made it all work. This is the fun of live podcast.
Yeah, that's right.
So thank you so much for all your great messages to our listeners. So many good pearls of wisdom for them on overall health and sexual health. And sexual health is a barometer of overall health. So thank you, and we appreciate you being here. Thank you, Vic, for punting for me this evening. And thank you, listeners, for being here. We really appreciate it. Hope it's helped. Good night.
Thank you, Jeff.
Who's Dr. Jeff talks about sex and intimacy, breaking down the science, setting your spirit free with stories, wisdom, laughter, and care. Connection.